Hi, my name is Amanda Gray, and I am a wellness education specialist for CoxHealth. And today I'm going to talk about cancer prevention and early detection. And some of the things that we're going to talk about today will be to get a basic understanding of how cancer develops. We're going to talk about potential risk factors that contribute to certain types of cancer, and we're going to learn about the different health screenings that you should be doing to make sure that you're detecting cancer at an early stage. So, to start off, we're going to go back to high school biology. So if you slept through high school biology, you can learn a little bit right now. We're going to just talk about understanding cancer. How does it grow? So from high school biology, you probably learned that we have cells. Our body's made up of millions and millions of cells, and those cells grow and divide to form new cells as the body needs them. So when cells grow old and die, new cells are formed. But it's kind of the craziness of that cell development that is what causes tumors, which eventually can lead to cancer. So when you've got old cells that have some sort of component that's a little bit off, and they go ahead and duplicate, then they're duplicating these cells that have problems in them, and that's what causes tumors to form. So understanding cancer, tumors can be benign or they can be malignant. Benign tumors are those things that are non-cancerous. They're easy to remove from the body. Malignant tumors are the ones that are cancerous. They're not going to be easily removed, and there's actually going to probably be more treatments that'll be needed after the fact. Cancer can spread to different parts of the body, which is actually called metastasizing. And it's helpful to know that whenever a tumor or a cancer moves to a different type of the body or a different part of the body, it's still that original cancer. So breast cancer, for instance, can sometimes navigate and move towards the bones. And when it moves to the bones, it's still breast cancer. The cells that are there are still breast cancer cells. It's not a new cancer. So that's very important to keep in mind with cancer is even though it spreads and moves to other types of the body or other parts of the body, it's still that original cancer. Cancer incidence, right now there's over 1.6 million new cases of cancer each year in the United States, and over 34,000 in Missouri alone. There are 565,000 Americans will die from cancer this year. And cancer is the second most common cause of death in the United States. It's only exceeded by cardiovascular disease. But one thing that's really good to know is we do have 14.5 million survivors, and that number keeps going up because of all the research that is done with cancer. So how do you reduce your cancer risk? There's several different things that you can do to reduce that risk. The first would be to see your healthcare provider regularly. If you do not have a healthcare provider, please feel free to contact me and I'll give my information at the end, and we'll be happy to help work to get you a healthcare provider. That is a relationship that is important for any aspect of your health. You get to know your provider, they get to know you. They get to know what your body is like, what's normal, what's not normal, and they can help advocate for your health. So make sure that you have a healthcare provider. Avoid any type of tobacco. Any type. All types, every bit of it, it's bad. Don't use tobacco. So we will talk a little bit about different types of cancers, and you're going to see that that's a common factor in several different types is tobacco use. Protect yourself from the sun's rays. I had a little altercation last week where I was actually outside, forgot to put sunscreen on, ended up just absolutely charred. So don't follow my lead. Use sunscreen, have it in your car, have it in your purse, have it everywhere, so that way you have access to that because it is extremely important. Skin cancer, as we'll talk about here in a few minutes, is actually the #1 type of cancer that there is. Remain physically active. Maintain healthy eating habits and stay on top of these routine health screenings that I'm going to talk about here in a few minutes. So let's talk about identifying risk factors. There are certain risk factors that are continuously present for different types of cancer that I'm going to talk about. One of them is smoking, which we talked about. Consumption of alcoholic beverages. Now, when I say this, I'm not saying that glass of wine that you enjoy a few times a week, things like that. I'm talking about consistent overuse of alcohol. That can be a risk factor for different types of cancer. A diet that's high in fat. and then lack of physical activity and being overweight. All of those are different risk factors for cancer. So now we're going to kind of switch gears and we're going to talk about 5 different types of cancer. These are the most common ones. There's no way I would have enough time to talk about every type of cancer out there, but these are ones that have screenings attached to them and things that you should stay on top of. The first one is breast cancer. Breast cancer is the most common type of cancer in women. More than 250,000 women and 2,600 men will get breast cancer. So this is not something that is specifically to women. There are men that get breast cancer. The men that generally get breast cancer do have a family history component. So they have grandma, mom, sister, somebody has had that. So it's not a common thing for men, but I don't want you to imagine that it's not out there, because it is. And there are several different types of breast cancer. It's not just breast cancer. There's inflammatory breast cancer. There's ductal breast cancer. Different types, and every single one of those is diagnosed and treated differently. So the risk factors for breast cancer, age is one of them. You start getting mammograms typically at age 50. So 50 is your starting age, and breast cancer is generally between the ages of 50 and 70. Reproductive and menstrual history is part of it. A lot of your breast cancers are actually hormone-based. So the longer you have those hormones in your body, the elevation of risk is there. So if you're someone who started having menstruation at 10, 11 years old, you've had several years of that happening, and it's increased your hormones for a period of time, so that increases your risk. Lack of physical activity. Family or personal history. This one is not as strong of a component as people would like to think with breast cancer. When you hear about breast cancer, that's usually one of those first questions when you hear somebody that's had it. It's, oh, was it in your family? Well, that's not typically the case with breast cancer. Only 5 to 10% of breast cancers are actually genetic. The rest of them, it's the first time that anybody's ever had breast cancer in that family. So it's definitely something to keep in mind. Overweight and obese, those people tend to be at a higher risk, and then just those that drink alcohol to excess. Signs and symptoms of breast cancer, any sort of breast lump, thickening, any sort of irritation, even skin rashes. Inflammatory breast cancer actually shows as a skin rash. It doesn't show as any sort of lumps, so that's something to keep in mind. Any sort of nipple pain, scaliness, discharge, any of those things can be a sign of breast cancer. So if you are someone who does self-breast exams, anytime you have anything like that happening, it's important to make sure you see that family physician and see if further testing is needed. So screening guidelines. Over the last few years, there's been all sorts of controversy regarding when people should have mammograms. There's 2 different aspects here. The first one is the United States Prevention Safety Task Force, and they have recommended that if you're under the age of 50, it's your choice on whether you should have mammograms at all. If you're between the ages of 50 and 74, then you should have mammograms every 2 years, and they are against a self-breast examination. The American Cancer Society, they believe if you're between the ages of 40 and 44, it should be your choice on whether to have mammograms. If you're between the ages of 45 and 54, you should have annual mammograms. And then if you're over the age of 55, mammograms either annually or every 2 years. And they're also against self-breast examinations. At this point, insurance companies have not really followed either one of these guidelines. They've stuck with the old guidelines that they pay for mammograms at the age of 40 annually. So this is one of those instances when I tell you, check with your family physician. Go with what you are most comfortable with. If you are comfortable with having them every 2 years and you fall in that group and your physician's okay with it, that's great. You really have to do what's best for you, not necessarily what the guidelines say. Now we're going to talk about prostate cancer. Prostate cancer is the most common type of cancer in men. 1 in 6 men will get prostate cancer in their lifetime, and there are about 181,000 new cases each year. So the risk factors, age of course is one of them. Not that we don't see prostate cancers in men under the age of 50, but generally it tends to be 50 and over. Race and ethnicity is one. Right now, African American men tend to be at a higher risk for prostate cancer. Researchers haven't really figured out why, but there are a few more African American men that are getting diagnosed. The family or personal history is one with this. If you have a dad, an uncle, a brother that has been diagnosed with prostate cancer, it does elevate your risk. And then diet. So when you have a diet that doesn't have a lot of fruits and vegetables, lots of red meats, lots of high-fat dairy products, that does increase your risk of prostate cancer. Signs and symptoms: frequent pain, having problems going to the bathroom, having problems with the flow. You either have too much or too little. One of the big ones is blood in your urine. Anytime you have blood in your urine, it is not normal. So it does not mean you have prostate cancer, but it does mean that something's a little bit off and you need to see your physician. Screening guidelines. This is one that I really harp on for men because there's two different things that need to happen, and they both need to happen to properly be checked for prostate cancer. Not one or the other, but both. And the first one is to have that digital rectal exam with your physician starting annually at age 50. It's not pleasant, but it needs to be done. When that happens, your physician is actually feeling your prostate to see, is there any lumps? Is there anything that just feels abnormal? Is it the right size or is it too big? They're feeling something to see if there's anything there that's just abnormal. The second part of the screening is having your PSA, which is your prostate-specific antigen blood test, done annually at age 50. And that is basically checking for that antigen that's prostate specific that tends to increase when there's something going on with the prostate. The reason I say both of these are important is because you can have one thing done. Let's say you go to the doctor, you have your PSA tested every single year. It's normal every single year, but you don't ever have the other one done. But you start to have some of those signs and symptoms. And when you go in and your doctor actually does that digital test, they feel something that is not normal. So that can be one way to do it. But the other side, let's say that you're somebody that has that digital test done every single year and everything feels normal, the doctor feels that it's normal, you never have the PSA done. When you do have it done because you're starting to have signs and symptoms, that PSA is way off the charts. The combination of both is what really diagnoses prostate cancer. So it's important to do both of those. Now we're going to talk about colon cancer. It is the third most common type of cancer in men and women. 95,000 new cases of colon cancer each year and 39,000 new cases of rectal cancer each year. And there are nearly 49,000 deaths per year. So risk factors, there's a reason that they started doing colonoscopies at age 50, because 50 and over tends to be the age that someone's diagnosed with colon cancer. Not to say that it doesn't happen with younger people, but it does. Smoking is a big risk factor for colon cancer. People that have ever had problems with chronic inflammatory disease, so Crohn's disease, things along that line, it does increase their risk of colon cancer. Diet is a big one with this, so a diet that's high in red meats and processed meats, low in fruits and vegetables, being physically inactive elevates your risk. And then also with this one, there is that family history, personal history type of link. So if mom, dad, grandparents, brothers, sisters, cousins, if they've had colon cancer, it does elevate your risk a little bit. Signs and symptoms of colon cancer: rectal bleeding, any sort of change in bowel movements, abdominal bleeding, pain. The big one for this is unexplained weight loss. Now, I always joke when I talk about this, when most people lose weight, if they lose 10 pounds in a week and you say, hey, how did you do it? I don't know, I didn't do anything to do it. It was great. It's not normal to lose an excessive amount of weight without trying in a short amount of time. If that happens, it's something to be checked out. Doesn't mean you have colon cancer, but something's off and it's worth getting checked out. Screening guidelines. I've got 3 different screenings up here, and I'm going to kind of walk you through them. The first one is a fecal occult blood test, which is basically sending a stool sample into your physician, and the physician's going to look under a microscope, see if they see any blood. If they see any blood, the nurse is going to call you and say, hey, we want you to come in for further testing. That's one option. Your second one is the double contrast barium enema, and that can be done, and basically you ingest a substance. X-rays are done to see if there's anything that's abnormal. If they see something abnormal, the nurse is going to call you and say, come in for further testing. So in both of those instances, that further testing that I'm talking about is the colonoscopy. So work with your physician, see which one you would like to do. To me, if you're going to end up having the colonoscopy anyway, it's probably best just to do that to begin with. Colonoscopies are done every 10 years unless you have a polyp or a polyp's removed, and then usually that happens a little bit sooner for your next one until you're clean. What's great about a colonoscopy, not only does it diagnose colon cancer, but it prevents it, because if they see something that's abnormal, they're going to immediately remove that, which is going to prevent it from becoming a full-fledged colon tumor. So very, very important to stay on top of your colonoscopies starting age 50 every 10 years. The next one I'm going to talk about is lung cancer. Lung cancer is the second most common type of cancer in both men and women. 224,000 new cases every year and nearly 158,000 deaths. This one tends to be pretty deadly, and we're going to talk about that here just in a minute. Some of the risk factors, they're typical risk factors that you would imagine with lung cancer. Smoking, being around all sorts of hazardous chemicals without wearing the proper protection, that can elevate your risk for lung cancer. Signs and symptoms, a cough that just doesn't go away, or reoccurring lung infections. So let's say you've had a lung infection, you go to the doctor, you get on antibiotic, you think it goes away, it starts right back up again. So you've run through all these different antibiotics and we're still not seeing any sort of success. That's not a typical thing. That can be a sign or symptom of lung cancer. The unexplained weight loss or loss of appetite, that's one that happens with this. And then chest pain or shortness of breath. And this right here tends to be the thing that'll send somebody to the emergency room, and lung cancer will get diagnosed because of this right here. So let's pretend you're a smoker for several years, you're hanging out on a weekend, got chest pain. What's the first thing you're going to think? I'm having a heart attack. So what are you going to do? You're going to go to the emergency room. When they start doing those x-rays, the tests, everything like that, they're going to find a large tumor that's pushing on everything, and it's causing that chest pain, it's causing that shortness of breath, and that is right when you get diagnosed with lung cancer. And by then, it's so large, it's already causing problems. A lot of times it's too late to do anything with it. So that's why this death rate for lung cancer is so high, is because we don't have a very good screening tool for lung cancer right now. One thing that started within the last couple of years is they've started doing low-dose CT scans for individuals that they consider a high risk for lung cancer. And the whole goal here is to see if they can detect this lung cancer with that low-dose CT scan earlier, to be able to change the outcomes for that person and extend life. So if you're someone who's between the ages of 55 and 74, if you have a 10-year life expectancy, and if you've smoked 1 to 2 packs a day for 15 plus years or more, or if you've just quit smoking within the last few years, but you smoked that heavily, you may be somebody that would be a good candidate to have this low-dose CT scan done and see if it's something can be detected. The whole goal is they're trying to figure out if it's worth making these low-dose CT scans a typical screening guideline, just like the colonoscopy, just like the mammogram. So hopefully another 5 to 10 years, I think you'll see some sort of screening tool out there for lung cancer. And the last one I'm going to talk about is skin cancer. Skin cancer is the most common type of cancer that there is. There are 76,000 new melanoma cases per year, 10,000 deaths from melanoma, but there's 3.5 million non-melanoma cases every year. That's a lot. So that sunscreen that I talked about is a huge, huge thing to do to try and prevent one of the most common types of cancer. There's 3 types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Those first 2 are generally the ones that you go to the doctor, you have it removed, that's it. It may come back in a few years, you have it removed again, but it's nothing that's going to cause more treatments than just having it removed. Melanoma, you're going to probably have more treatments involved with that. So risk factors, typical risk factors that you would think of: exposure or overexposure to UV radiation, a history of serious sunburns, having abnormal moles. You know your body. If you're just somebody that's always had abnormal moles or lots of freckles, it can elevate your risk for skin cancer. And individuals with blonde hair, red hair, fair complected, they're at a little bit of a higher risk. And then those with weakened immune systems, so people that are already fighting something else. Maybe they're on chemotherapy from another type of cancer. Their body's not able to fight off that UV radiation like it normally would, so that does elevate their risk for skin cancer. Signs and symptoms, you just need to remember your ABCs with this. So every single day when you get out of the shower, just take a quick look of your skin. Look at your different moles. If you see any that have become asymmetrical, if their borders have become irregular, if the color is changed a little bit, if the diameter's gotten larger, or if they've just evolved, it's something to check with your physician and see about, possibly getting it looked at. Screening guidelines, like I just mentioned, the self-examination is a huge one. And then just whenever you schedule that annual physical with your physician, ask them to do a skin check when you go. See if they'll take just a few extra minutes just to look at everything and make sure everything looks normal. So in summary, some things to do to prevent cancer would be to eat a healthy diet rich in fruits and vegetables, try and stay physically fit, maintain a healthy weight, keep up with the regular screening. So if you're getting to the age of 40 and 50, that's when the fun starts with all of this, and you start to have the colonoscopies and the mammograms. But stay on top of those. Work with your physician and make sure that you're staying on top of those. And use your sunscreen. The things not to do, don't use tobacco products of any kind. Don't drink excess. And then don't ignore any signs and symptoms that you have. Even if things have checked out in your last physical, and you start to have signs and symptoms, go get it checked out immediately. Most cancers, if caught in the first stage, can be taken care of very, very easily, but once you let them go too long, it tends to be a bit more of a difficult process. So if you have any further questions, please feel free to email me, amanda.gray@coxhealth.com. Thanks.